Good day, I'm Sadini Gunasinghe from Group 25 and today I'm going to demonstrate post-operative care for patient who had elective neck lipoma surgery. So first I'll tell you what is lipoma. Lipomas are soft fatty lumps that grows under your skin. They are harmless and do not usually need any treatment. It is also not cancerous, so that's why it's an elective procedure which will be carried out of the patient. Elective surgery, also known as elective procedure, it is a surgery which is scheduled in advance because it does not involve a medical emergency. So the date of the surgery is pre-planned and the person will usually come one day before the surgery and admitted into the hospital. So firstly, the post-operative care of the patient starts immediately after the surgery, where the patient will be transported to post-anesthetic care unit, and in this unit, the patient will be taken to check the consciousness, and if they didn't regain their consciousness, they will again be demonstrated about in 15 minutes. So once the patient has regained their consciousness, the doctor can make his first visit, which means it is received in the PAU unit. As an example, if the surgery had occurred at 7 or 8 a.m., the patient will be probably remain in the PAU for 1 to 2 hours, maybe before the patient is transported into his private ward. First, let's begin with what you will be checking when the patient regains his consciousness. So, when they regain their consciousness, first we have to make sure that they are in alert. For this, we can ask some basic questions such as, "Hello sir, can you hear me?" And you can ask for their name, if you know where they are, how they feel at the moment. From asking these questions, we can make sure that the patient is in alert. Hello sir, can you hear me?
Yes.
Can you remember your name?
Yeah, I'm living.
Where are you now?
I think I'm in the hospital.
Oh yeah. So you had a neck lipoma surgery and the surgery went successful.
Okay.
And now I'll check your vital signs. And we can check the vital signs of the patient such as heart rate, blood pressure, respiratory rate, temperature, and their skin color. It's important to remember that for the first 2 or 3 visits can be done between every 15 minutes. So if patient's condition is normal in your first visit, the time of the second visit can be doubled. As an example, if you come for the second visit 15 minutes after the first visit, and if the patient's condition remains normal, you can double the time duration between the second and third visit. So it means for this third visit, you can come in 30 minutes instead of 15 minutes, and in fourth visits in 1 hour, and so on. First, I'll check for your pulse rate. Your pulse rate seems fine. And let's check your heart rate now. Heart rate also seems fine. Can you breathe normally?
Yeah, I think so.
Yes, your breathing rate is also seems fine. Let's check your temperature now. Very important to keep an eye on the vital signs of the patients because the changes in these vital signs may be represent post-operative shock due to internal bleeding or dehydration, inflammation, or post-operative infections as well. So it's very important to take records of these vital signs regularly and keep eye on the patient as well. In case of post-operative shock, the patient might be confused and his skin might be clear and pale. So it's important to pay attention to these things as well. Nowadays, with the help of technology, the digital monitors can help medical professionals to keep an eye on the vital signs of the patients very easily. When considering the temperature of post-operative patients, 37 degrees are normal, even though it may be a little high for the normal patients. But if their body temperature rises to 38 to 39 Celsius, then you must keep an eye on them and must be reported as soon as possible. Skin color of the patient must also be recorded. It could be pale, normal, or cyanotic blue as well. Blue skin usually indicates cyanosis or lack of oxygen. Pale skin may be a sign of internal bleeding. So these signs must be recorded very carefully as well. Additionally, wound drainage, NC-tube losses, and output of the urination can also be monitored as well. Your vital signs are seems normal. Now let's check for the surgery side. Do you feel any pain?
No, no pain actually.
So there are no redness or swelling there. So there are no signs of inflammation or infection. So are you feeling uncomfortable or are there any concerns?
No, I don't think so.
Okay, so I'll be there in 10-15 minutes to check your vital signs and everything.
Okay.
So have a good day.
Okay. Same.